For those of you who are always on the go, remember mindful moments.
Bite-sized knowledge, right?
Exactly. Perfect for those mental snacks throughout the day. Narrated by AI, too. What if everything you thought you knew about the pandemic, like everything was wrong? What if, the people in charge, the ones we trusted to keep us safe, were actually blind to the threat, like they just didn't see it coming?
Yeah, it's a pretty unsettling idea.
It really is.
And that's exactly what Michael Lewis explores in his book, The Premonition. It's the untold story of the people who actually saw COVID-19 coming, way before it hit.
And they tried to warn everyone.
Right, exactly. Tried to warn the world.
So in this deep dive, we're going to kind of unpack all that.
Oh, yeah. We're going to go deep into that story. It's a fascinating story, really, and a frustrating one, to be honest. It reveals a lot about how our systems work or don't work when it comes to like unexpected threats.
Right, yeah. So Lewis introduces us to this group. He calls them the Wolverines.
Yeah, the Wolverines.
A group of doctors and scientists kind of outside the mainstream.
Yeah, working in these unconventional settings, but they were the ones who could see what others missed.
Because they were outside the system, maybe?
Maybe. It's like they had a different perspective. Like Carter Meacher, he was this, Lewis calls him a redneck epidemiologist.
Redneck epidemiologist, huh?
Yeah, working for the Veterans Affairs Department.
Okay, so not exactly the center of the pandemic response world.
No, not at all.
But what was it about Meacher that made him, so key to all of this?
Well, he wasn't part of that traditional public health world, but he could see patterns. Like, he really understood how systems could break down.
Right.
And he kind of honed those skills in, well, a kind of unexpected place, investigating medical errors and trying to improve patient safety at VA hospitals.
He was like a medical detective.
Yeah, exactly. Like a detective, looking for clues in the data, the things other people might just overlook.
And that's what made him so valuable when it came to, understanding the pandemic.
Yeah, exactly. He could see the connections that other people were missing, and he wasn't afraid to challenge the conventional wisdom.
Which is probably exactly what you need in a situation like this.
Yeah, you need people who are willing to think differently. And then there was Richard Hatchett, a doctor who was drawn to government work.
Okay, yeah. He was one of the few people in the Bush White House who actually seemed to grasp the threat of a pandemic, right?
Yeah, he really got it. He was tasked with creating a national pandemic plan back in 2005 after the SARS outbreak.
So after SARS, people were like, okay, we need to be ready for the next one.
Exactly. And it was during this time that he came across the work of another really interesting character, Bob Glass.
Bob Glass.
Yeah, he was a scientist at Sandia National Laboratories.
Okay, this is where it gets kind of interesting because wasn't he helping his daughter with a science fair project or something?
That's right. His daughter Laura, she was building a model to simulate the spread of disease.
A disease model for his science fair project.
Yeah, but it was a good one. She used, simple rules of social interaction, things like how often kids interact, how close they get to each other.
Okay, so basic stuff.
Basic, but important.
But wait a minute. Are you saying that a teenager's science fair project, inadvertently led to a breakthrough in pandemic modeling?
It sounds crazy, right? But that's exactly what happened. Glass realized that his daughter's model, even though it was simple, it captured some really fundamental truths about how diseases spread, and he started to develop it further.
Oh, wow. So he turned it into a real scientific model.
Yeah, created a more sophisticated model that could, simulate pandemics on a larger scale. And this model eventually landed on Richard Hatchett's desk.
So what was so groundbreaking about it? What did Glass's model show that other models didn't?
Well, the model showed that schools were major vectors for disease transmission.
Schools?
Really?
Yeah. And that seemingly simple insight, it had huge implications for how we think about, pandemic mitigation.
Right.
Because if you can close schools early in an outbreak, well, you can dramatically slow the spread of the virus.
That makes sense. But if this model was so insightful, why wasn't it immediately embraced by the public health community?
There was a lot of resistance at first. Some experts thought it was too simple, too unconventional. They were used to thinking about pandemics in terms of vaccines and antiviral drugs.
Right, the traditional tools.
Right. So the idea of social distancing, shutting down schools and businesses, it all just seemed too drastic, too disruptive.
Too much of a departure from the way things were always done.
Yeah, exactly. But there was also this other piece of the puzzle that was starting to emerge.
Okay, what was that?
Carter Meacher, he had been studying the history of pandemics.
Okay. And he uncovered some fascinating information about the 1918 flu pandemic. He found that cities that implemented early and aggressive social distancing measures, things like closing schools and banning public gatherings, they had significantly lower death rates.
Then cities that didn't do those things.
Exactly.
Wow. So social distancing wasn't just a theoretical concept. It actually had a proven track record.
Yeah, a track record of saving lives.
And this research, this historical data, this was key in persuading the CDC to at least consider social distancing as a strategy.
It was a big step. But there was still a lot of skepticism. Changing the way people think about pandemics, especially within these big institutions like the CDC, it's a slow process.
So we've got this small group of outsiders, the Wolverines, who are seeing the pandemic threat more clearly than the people who are supposed to be in charge. They've got this groundbreaking model that shows how social distancing can work, and they've got historical evidence to back it up, but they're still facing an uphill battle. So what happens next?
Well, the threat of a new pandemic, it's becoming more and more real. And the Wolverines' warnings, they're getting more urgent, but they're increasingly at odds with the official line from the CDC. And that's when another really fascinating character enters the story. Joe DeRisi, a brilliant scientist who created this groundbreaking tool called the Vero chip.
Okay, yeah. The Vero chip. I've heard of that. It's like a super tool for identifying viruses, right? But how does it actually work?
It's based on a technology called a microarray. Basically, it's a small chip that contains thousands of tiny spots. Each spot contains a different piece of genetic material. So when a sample containing a virus is applied to the chip, any viral genetic material in the sample, it binds to its matching spot on the chip.
Oh, wow.
And that allows scientists to identify the virus.
So it's like a genetic fingerprint scanner for viruses.
That's a great way to put it. And DeRisi, he had already used the Vero chip to solve the mystery of the SARS outbreak back in 2003.
Oh, right.
And as the threat of a new pandemic, loomed larger and larger, he realized that the Vero chip could be critical for rapid identification. Like if a new virus popped up, they could identify it really fast.
Which would give you a huge head start on developing treatments and vaccines.
Yeah, exactly.
So DeRisi was eager to put the Vero chip to work in the fight against the next pandemic.
He was ready to go. But as we'll see, he ran into some pretty significant obstacles, just like the other Wolverine.
So we've got these incredible minds, these groundbreaking tools, and this looming threat of a pandemic. But it feels like a storm is brewing.
You're right. And that storm is about to break. So as we kind of move into those early days of COVID-19, there's this really remarkable figure who enters the picture.
Charity Dean, right?
Yeah, Charity Dean. She was a public health officer in California, and she had this almost uncanny ability to see outbreaks before they happened.
Yeah, I mean, from what I read about her, she was not your typical bureaucrat.
No, not at all. She was fearless,
Right.
willing to challenge authority, take risks to protect public health.
Yeah, she just she had this drive, right? This deep-seated belief that pandemics were a real threat.
Oh, absolutely, and that we weren't doing nearly enough to prepare.
You mentioned she had this knack for spotting outbreaks.
Yeah.
Can you give us an example of how that played out in her work?
Sure. So there was this doctor in Santa Barbara. He was spreading hepatitis C in his stem cell clinic.
Oh, wow.
And Dean, she suspected something was wrong, and she went head to head with this really powerful physician.
Taking on the medical establishment.
Yeah. And she ended up exposing a serious public health risk that everyone else had just totally overlooked.
It sounds like she was constantly pushing against the system. Battling bureaucracy and complacency.
Oh, she was. And that experience combined with her knowledge of pandemic history, it made her acutely aware of the dangers of a new virus, like the one that was emerging in Wuhan.
So while a lot of people were still downplaying the risk, Charity Dean was already sounding the alarm.
Yeah, she was way ahead of the curve, and she was getting really frustrated by the slow response from the CDC and other authorities.
She just knew it was serious, right?
She knew. She understood exponential growth. She knew that even a small number of cases could, quickly spiral out of control.
And no one was listening. It must have been incredibly frustrating.
It was. She tried to raise her concerns within the California Department of Public Health, but she was met with, resistance.
Really? What did they say?
They told her if it was a real threat, the CDC would let them know.
Oh, come on.
But Dean, she wasn't satisfied with that answer.
Good for her.
She knew that time was of the essence.
So what did she do? Did she just, give up and accept the official line?
No way. Remember those Red Dawn calls?
The ones organized by Dwayne Caneva, yeah.
Yeah, those calls. Well, Charity was brought into that group.
So she connected with the Wolverines.
She did, and it was a lifeline for her, a place where she could connect with people who actually understood the gravity of the situation.
People who were on the same wavelength.
Yeah, people who got it.
Yeah.
And Charity, she brought a crucial perspective to the group, too. I mean, she had firsthand experience dealing with outbreaks, on the ground.
Right. She'd been in the trenches.
Exactly. Navigating the complexities of, public health bureaucracy. And she could see how ill-prepared the system was.
So while the Wolverines were running their models and analyzing data, Charity was providing that real-world context.
Exactly. She was showing them how the system was already starting to break down.
And as the situation in Wuhan got worse, the Wolverines became increasingly focused on a particular event, the Diamond Princess cruise ship.
Yeah, the Diamond Princess. It was quarantined in Japan.
Right. It became this floating petri dish, this terrifying example of how quickly the virus could spread.
It was a wake-up call, and for Carter Mitcher, the Diamond Princess was it was like a real-time case study, a microcosm of what could happen if the virus if it took hold in the US.
So he was using the Diamond Princess to model what could happen.
Exactly. He was meticulously tracking the number of cases, the number of deaths, using that data to estimate the infection rate, the fatality rate.
And were his findings in line with what the CDC was reporting at the time?
Not even close. Meacher's calculations showed that the virus was way more contagious, way more deadly than the CDC was acknowledging.
So the official word from the CDC was still, the risk to Americans is low.
Yeah, they were downplaying it.
But the Wolverines were seeing a very different picture.
A much scarier picture.
Yeah. And as the virus started to spread beyond China, they knew time was running out, right?
They did. They tried to sound the alarm, but no one was listening. The public health system, it was already weakened by years of neglect, underfunding.
It just wasn't ready for this.
No, it wasn't. It was like watching a slow-motion train wreck,
You know what's coming, but you can't stop it.
Exactly. And as the pandemic unfolded, the Wolverines watched in disbelief as the U.S. just stumbled, fumbled.
Failed to contain the virus.
Totally failed. The Trump administration's response, it was chaotic, contradictory.
It made things worse.
It did. And in the midst of all this chaos, Joe DeRisi, with his state-of-the-art lab at the Chan Zuckerberg Biohub, he tried to step in and help.
Right. DeRisi, the guy with the virus-identifying super tool. What was his role in all of this?
Well, he saw an opportunity to use his lab's resources to address the testing shortage. They could process thousands of tests per day, really fast turnaround time, and they were offering it for free.
Free testing? That sounds amazing. Why would anyone stand in the way of that?
The problem was the system itself. The U.S. healthcare system, with its billing codes and bureaucracy, it just wasn't designed to handle a free service.
Like the system was working against them.
It was. And to make matters worse, the strategic national stockpile, the one that was supposed to have all those masks and protective gear, It was a disaster. The supplies were outdated, unusable. Some of them were just non-existent. They couldn't even find enough nasal swabs for the tests.
Wow. That's shocking. How could they be so unprepared?
It was a symptom of a bigger problem. A lack of preparedness, a lack of foresight, a failure to learn from past mistakes. And as the pandemic raged on, the Wolverines watched with growing frustration as the U.S. just, kept making the same mistakes.
It's like they were trapped in a time warp or something, just repeating the same failed strategies.
Yeah, it was like they weren't learning anything. But what about Charity Dean? Was she still stuck in that bureaucratic maze at the California Department of Public Health?
Yeah, what happened with her?
Well, she was still there, but she was working tirelessly behind the scenes, trying to convince her superiors to take a more data-driven approach. She knew that every day of inaction meant more infections, more deaths.
Right.
She understood that to fight the virus, you needed to track it, you needed to understand how it was spreading, how it was evolving, and for that, she knew you needed genomic sequencing.
Genomic sequencing, that's the process of analyzing the virus's genetic code, right?
Right, to understand how it's changing, how it's spreading.
And Dean knew that this was crucial, not just for developing vaccines and treatments, but also you know, for implementing those targeted public health measures.
She was absolutely right. But she faced so much resistance within the California Department of Public Health.
Really? Why?
They were hesitant to adopt this new technology, They were clinging to those old methods that just weren't adequate.
So even within her own department, she was fighting this uphill battle.
She was. But Charity Dean, she was not one to give up easily. So, she's pushing for this data-driven approach, especially using genomic sequencing. Did she actually make any headway?
Well, yeah, she did. It wasn't easy though.
I bet.
A lot of persuasion.
Yeah.
And maybe a little bit of luck.
Mm-hmm.
She finally got a chance to present her case directly to Governor Newsom.
Oh, wow. So she got to go right to the top.
Yeah. And Newsom, he had just taken office. He was already, kind of showing signs of being more proactive than the feds
Yeah.
when it came to responding to the pandemic.
Taking it seriously.
Yeah, and I guess he was more receptive to Dean's ideas.
So she finally found someone who would listen.
Yeah, he was impressed, by her knowledge, her passion,
Right.
and her assessment of the situation. Just, really clear-eyed Newsom. I mean, he recognized that California needed to be more aggressive,
Yeah.
in their response, and he saw the value in Dean's approach.
The data-driven approach.
Exactly. So what happened? Did he give her the green light?
He did. He tasked her with building a team to implement genomic sequencing, like statewide.
So she finally had a chance to put her ideas into action.
Yeah. It was a huge opportunity for her, to really make a difference.
After all that frustration, it must have been pretty gratifying.
Oh, I'm sure it was. But it also kind of, it highlighted how messed up the public health system was. California was moving towards this, this data-driven approach.
Mm-hmm.
But the CDC was still resistant. Like they were stuck in the past,
Still clinging to those old ways of doing things.
Yeah, exactly. It's incredible to think that a single state, was leading the way while the federal agency was lagging behind.
It's mind-boggling, really. But, it wasn't just the CDC. We talked about Joe DeRisi, right? Trying to provide free testing.
Right, at the Chan Zuckerberg Biohub.
He ran into all those bureaucratic roadblocks.
Oh, yeah. It was a nightmare for him. Those billing codes, they were just the tip of the iceberg, He was battling this whole regulatory system.
Like the system itself was designed to prevent a rapid response.
Yeah, it was. And it's heartbreaking, because every delay, every bureaucratic hurdle, it just meant more people getting sick, more people dying.
The human cost was just immense.
It was. And, the pandemic, it wasn't just a scientific event or a medical event, right? It was a social and political event, too.
Right. Yeah, it really exposed, all these cracks in our system.
Yeah. And our values,
Yeah.
our priorities, the way we responded to the virus, it said a lot about who we are.
And the premonition, it really forces us to grapple with all of that, with those uncomfortable truths. It's a story about a pandemic, yeah, but it's also a story about, about us.
Yeah.
About what we're capable of or not capable of when we're faced with a crisis.
Exactly. And those questions, they're still relevant today, Even though the worst of the pandemic is over, we have to ask ourselves, are we ready for the next one? Have we learned from our mistakes?
Yeah, those are the big questions. Are we going to be better prepared next time?
And the Premonition, it's an essential read for anyone who wants to understand, how we got here and what we need to do to prevent this from happening again.
It's a powerful book.
Mm-hmm.
I highly recommend it to all our listeners. And if you found this deep dive insightful, please share it. These are conversations we need to be having.
Absolutely. The more people who are aware of the challenges, the better.
So thank you for joining us on this deep dive into the world of pandemic prevention. Until next time, stay curious, stay informed, and stay engaged.
And stay safe out there.
You'll find a link to purchase the book in the show notes.